and thanks a lot for having me today. The topic that I brought to this group is one that I would like to share with you because it is something that we cannot do as one company. We have to do it together. So this is going to be the biggest word. To introduce myself, I'm working at Aurora, and I've got two things that I'm really passionate about. One is the international sales, so I love to make revenue, just as you are. And the other one is the business development part, which is finding new ways of doing so. So to go into the title, I would like to expand the prescriber and patient base together with you and find the right engine to do that. While we're looking today at a lot of different presentations that are talking about new markets, new opportunities, or for example, a legalization in Germany, I strongly believe that the existing markets right now have got a lot of potential that is still untapped. And we can do that together. So let me take apart my title of the presentation into the 4 core things that I want to talk about. First, expanding the prescriber base. My colleague Cornelius Maurer from Demican also talked about it. We've got 0.1% of the German population being in a cannabis prescription medicine pattern, and the Canadian model actually is around 1%. So we still have got a lot of market to take. Together, we share the same goal, so we can also unite all these forces to get to that goal quicker or more efficient. What I see as one of the key points is successful treatment evidence, and I will go into detail during the presentation, but I've seen a lot of interesting things in a lot of congresses, especially from doctors, more from the commercial side. And the growth engine that I want to talk about is really the prescribers that we have got right now and the prescribers that we can have maybe in the next years. So to shortly talk about Aurora, we stand for the same thing that you also do, high quality products for all the patients and for all the doctors among the different countries. And our vision is very simple. We want to create better days. What that means is we want to help patients, we want to support them. And I think every single one of you has read this one email from a patient that really makes you wake up in the morning and think, wow, I'm actually helping somebody. And this is really something that drives me every morning to go to work and do a better job than I did yesterday. So how do we do that? I'm going to take you to 2 little examples of how we would like to help people even more. So the first one is the country France. We've got the French pilot program set up that goes 24 months. We're serving around 3,000 patients across 5 indications. And we're producing cannabis flowers for this trial. Our colleagues are doing extracts and capsules. And we're basically supplying the pilot program for free because we believe in what we do and we believe in the future of medical cannabis. The ANSM did one thing very well that I would like to highlight, and this is the thing that fascinated me most about the market. So they had a mandatory education program right away from the beginning. It wasn't just put on the market. It's like, here you have it, and without any clinical evidence, you can just do whatever you want to do with it. They had a 13-chapter education program, including clinical cases, even quizzes. So you could not just lay back and watch a video and then do whatever you wanted to do. You actually had to participate. So I'm actually absolutely thrilled to see what's going to come out of that pilot program. This is France on one side. Then let's go a bit more into the medical scene. I'm going to take you to the UK. We have the campaign study, and if you type in campaign on Google, you will find right away a registered clinical trial for non-cancer related pain. We're also taking part with the balanced flower in this one that we're supplying together with a group of partners so that the LVL Health Clinic can conduct the study. Right now we're in the feasibility study, and the real study is going to kick off as soon as this one has taken off. So 5,000 patients in the UK among 3 years can also have the chance in a very good clinical setup just to be part of this clinical evidence that we're talking about. And I'm using the word evidence because clinical study is something very specific. So I'm taking the core of information from these 2 countries, and I'm going to go to the thing that was actually bugging me for a couple of months now, but I think I found a solution. But I'm going to remain humble. I definitely need more of your experience and your ideas to actually make it something great. And I'm being very honest about it. So clinical studies are requested by all the doctors. You come up to the door as a sales representative and they say, give me some clinical studies and I can buy or use your product for whatever I'm doing. It is a fair point. It is the way that medical systems work, but there's high costs involved. It is always limited to a certain product and indication or combination. We don't really know if this is the right match. And cannabis, let's be very honest, is such a big field. Like just talking about flower products, all the varieties that we're looking at, it is just so many of them that I thought patients need help today. Patients have got PTSD today, they've got cancer today, and these people cannot always wait for all the studies regarding all the products. So I just took a very simple sentence just to make it a bit clearer. You all know that saying, an apple a day keeps the doctor away. So let's imagine we have got the Gala apple and we're doing a study about the Gala apple, which is amazing. But you're also producing amazing quality cannabis flowers. So who's actually going to say that Golden Delicious, Honey Crisp, and Granny Smith are not also meant to be part of that an apple a day keeps the doctor away saying? So we see we've got a problem. Cannabis is a huge portfolio of products, and saying cannabis can help needs to be defined a bit more specific. So we actually need something that is outside of a clinical study. We need clinical evidence. Now, on my next slide, I'm going to try to underwhelm you with extremely low numbers, which is not very common among the cannabis industry. But I actually want to show you how small a market is and how much potential we still have. And please don't take these numbers as something that is very set in stone. It was a hypothetical assumption or an estimation of markets. So I did some research on the Canadian market. We've got 38 million people and roughly around 370,000 patients in that market. That is coming from Health Canada page. So we've got a penetration rate in the market of roughly 1%, which is already amazing if you compare to other markets. Now I looked at the prescribers because those are the ones actually making the change. They've got cannabis to serve the whole world 5 times. So it's actually about the prescription of the cannabis that we have. It's roughly 450 what I call specialized medical cannabis prescribers. These are prescribers that prescribe more than 25 grams a day. And why are they specialists? Because people actually have got to go to these specialists because the other ones are not educated yet, because it's not part of classical medical education, or because they just refuse to use medical cannabis. So taking this example, I went to other countries and tried to have a look at the similar numbers. And I found out that of these specialized prescribers or heavy prescribers, we've got roughly around 200 in Germany. That's nothing that I can really give you a source on. Talking to customers, pharmacies, partners, to a lot of people, we came up with incredibly low numbers because in Germany, we've got around about 400,000 doctors. So taking away all the ones that are not really that close to cannabis, we still have got 43,000 general practitioners. 7,000 neurologists, 11,000 psychologists. Where are they? Why are these 200 prescribers making the entire market? So we see this is an incredible low number for now and a lot of potential for us. So just staying in the German medical cannabis market, not even thinking about legalization, expansion, new markets, just staying in a domestic market. And then there is France. With the mandatory educational program that I've told you before about that I really like, we've got roughly 250 prescribers. So I'm going to call them specialized prescribers. They're not heavy prescribers in that sense, but those are the ones that actually know about cannabis. They are educated, the pharmacists are educated, and only the educated ones can also really apply a medical cannabis treatment. So I really like the education part of the pilot program because I think that education really is the key. And this whole thing, I would like to take you with me to something that is more of a personal story. That, 2 of my main markets are Poland and the United Kingdom. I love to develop new ideas in those countries, and my Polish is very basic. So it ends somewhere after yem yapko, which means as much as I'm eating an apple. So I'm not very familiar with the language, but I'm sitting in a Polish audience in the conference over and over again, and I always see the same thing. You can talk about the endocannabinoid system. You can talk about so many different things in cannabis. And doctors are writing emails, checking their books, talking to their colleagues, whatever it is. But once you take out a clinical case, a personal case, and saying, this is Greg, he's 57, he's got PTSD, he was a veteran, everybody dropped the phone and right away they went to the discussion mode. They took some notes. So you could actually see, without me really understanding a lot of what was going on because of the language barrier, you could see that they were fascinated about clinical evidence. It's not a clinical study, it's a one case thing, but it is what they are craving for. They need information, they need generalized, unified information. So I'm going to give you my assumption. Good practical medical knowledge from doctors for doctors will accelerate the growth for everyone. And I mean everyone in this room. I would like not to extend the market share of Aurora or take away some. I would like to grow this market for everyone, and especially thinking about the patients first. Because I think, I don't know who in this room is a medical cannabis patient, but if you actually ever started the treatment with a doctor, it is incredible how often you will just hear, no, I don't have anything to do with this, please go see another doctor. I've talked to a cancer patient in London whose doctor actually told her that he is going to throw her out of his own clinic if she keeps on asking for medical cannabis. Well, guess what? In the end, she switched the oncologist. He actually put her on a medical cannabis treatment. And the sad thing that almost made me cry when she told me is this doctor, the first doctor told her that she's going to die roughly like a year later. And 2 years later, I was talking to her on a conference. So I'm not saying medical cannabis can cure something, but it's actually incredible how even cancer patients get refused by doctors just because they don't know how to use medical cannabis. I would like to change that. And I cannot do it alone. We have to do it together. So, of course, I also brought an idea. I don't want to start a brainstorming session from nothing, but this is my plan, and I would be absolutely delighted to talk about it maybe later, having a glass of wine in this room all together or having a coffee. What is it that I'm talking about? First of all, real-life successful treatment cases. They cannot really be. They cannot be this one study because I want all the products of all participants actually to be part of it. So why does our flower and your flower compete if both flowers may have a completely different use? But as a flower, we could tell people if you use this flower, as you can see in these 15 cases, we had positive effects. It can be different flowers, but the benefit can still be the same. Who should do it? Maybe not us as the industry, because we always have a commercial interest in the whole thing. So to actually make it far more legit, it should be coming peer-to-peer from doctors for doctors, and we should just enable this whole entire exchange. How can we do it? Well, again, maybe not ourselves. We may need an independent institution to really check these findings, publish it, because you could say, with our commercial interest, we may favor one thing, but I also want to see contraindications. We also want to see warnings to say, do not use this when you have that. So it should be very clear that this is not pro-cannabis. This should just be transparency for cannabis. And why? Because faster access to practical knowledge means faster help. And as I mentioned before, people have got PTSD today and not in 3 years' time when a study is done. Some people in palliative care have got 0 time. So it would be amazing to have help in 6 months. So in fact, what I was drafting in Poland, and you all know these scribbles that you do at the end of a conference on back of the envelope, together with pain clinic professors, with doctors from Germany and from Poland, from Poland and from Germany, what we did was just to see how can we unify this knowledge? How can we make it a blueprint to actually bring this whole education or just the information that doctors bring forward? And we just said, it's actually just the blueprint. The content is going to come from doctors themselves. So the idea that I brought to you, and I would be really delighted if anyone else is also interested in accelerating education, is how can we unify knowledge to grow the pie for everyone? So I'm going to close this idea with a simple question. How can we work together to grow the pie? Thank you very much.